Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, my friends, these segments are typically about 5.5 minutes, so we do not want to waste any time. Facebook questions on the flu. Doctor, you ready?
Ready.
Okay, Dr. Jitka Lom is here, and she is standing by. First question comes from Sinahania. This is from Maria, Dr. Lom, saying, my child had the flu recently and was sore everywhere. Is this common?
It is. It's one of the most common symptoms of the flu, Marie, where the child will have body aches everywhere, every part of their body, including they feel like their hair and their nails hurt. Everything hurts, and that's due to the inflammation in the body that's really overwhelming, along with fever. And sometimes dehydration too, because people tend not to drink as much as they should when they have a fever. So it's very common, and just Tylenol or Motrin and thyme, lots of fluids, and those body aches will go away.
Also heard taking a bath or like a really nice shower
a hot
also
bath,
helps.
right.
Okay.
Yep.
Question number 2 is about a specific product, Dr. Lom. What is Tamiflu?
Okay.
Kay from Barragata asked, and is it available on island?
It is available, Kay, and Tamiflu is one of the 2 prescription antiviral medications. When I say antiviral, they don't kill the virus, they just suppress and help fight the virus. And it's a prescription medicine that you would take for 5 days if you get the flu. So if you get the flu and it's very severe, or you're a very sick person, sickly, you get in within the first two days of getting the flu, then you can start on this medication. And it will shorten your disease from 7 days down to 5 and make it less severe. And if, like we were talking about, if you're coming in on your 4th or 5th day of illness, it's really not worth it. But if you are a contact of somebody, let's say your husband is very sickly, he's diabetic with heart disease and lung problems, and he gets the flu, he'd be on that medicine for 5 days, and you could immediately start on that medicine and take it for 10 days to prevent yourself from getting sick.
Mm-hmm. No.
So you can take it as a contact of a sickly flu person or as the person with the flu.
And that would be the difference between suppressing it and trying to kill off so almost like preventive maintenance if you're...
Yeah, prevention.
Okay,
Yeah.
Excellent. Okay, a concerned parent is who this next person logged in on our Facebook wall. KUAM.com/Facebook is a URL you want to check out. This person asked, Dr. Lom, are there any side effects from the flu shot?
Yeah, and there's a lot of misconceptions about this one.
Mm-hmm.
Flu shot, people say, oh, I don't want to get sick from the flu shot. The flu shot, the injection is a dead virus that we put in to stimulate your immune system, so the immune system will later on recognize live viruses. So you cannot get sick from the shot. You can get side effects though, like body aches and a low-grade temperature, feeling very tired, because your immune system has been activated. But you are not sick with the flu. You can't pass the flu to anybody else. As far as other side effects, you might have a sore arm for a couple of days. There's
on account of the shot.
On account of the shot. There's another variety of the flu vaccine that's not that commonly used. It's a nasal spray. I don't know if many people have it on island, but it is a live attenuated virus, meaning that it's alive and you can actually get the flu from it if you're very sickly. So it's not recommended for people who are sickly or pregnant.
Okay, and just maybe a corollary to concerned parents' question. If you already have the flu and you're going through it, getting a flu shot at that point is irrelevant.
Right.
Okay.
So getting the flu shot takes about 2 weeks for the flu shot to kick in. So during that period of time, you could still get the flu from somebody else. So it's good to get the flu shot early in the season, right around now, from now till December, so that later on you can already be immune.
Again, preventive maintenance.
Yeah.
2 of the 3 questions have dealt with that.
Yeah.
Okay, here's a really interesting question, Dr. Lom. This one comes from John, and John asks, when exactly is a person, quote, contagious?
Okay, and that's really, really important, John. You're contagious from 1 day before you get sick to 5 to 7 days after you've been sick. So you're contagious for quite some time. So if you're coming down with something and you have a family member that's immunocompromised, meaning that they have a severe illness, they have cancer, or they're elderly with diabetes, then if you're getting sick, they should be aware, oh, this person's getting sick, I better be careful. If I get sick, I need to come in for Tamiflu or other medication to help them.
Okay. And our last question comes to us all the way from down south. Melinda joined us from Maritza, and she posted on our wall, at what point should I go see a doctor?
Well, there are complications of the flu. The flu by itself, most people, if they're healthy, they can fight it off and they'll get well. If it's on the 5th or 6th day, you're not getting better, you need to get seen. Flu can develop into pneumonia. It can develop into other severe infections, including brain infections, that need to be treated with antibiotics and to be in the hospital for it. So if you're not recovering like you would expect gradually over the 5 to 7 days, then you need to be seen.
Okay, well, that's some really interesting information, like about the flu, and like most things, there are a lot of myths, and like you said, like a lot of people just don't truly understand exactly what goes on, or like maybe it's some bad information that got passed and everything like that. But
yeah, many people are afraid of the flu shot, and it's unfortunate because unless you really have had an allergic reaction to it, which is pretty uncommon, you're safe getting a flu shot.
All right, Dr. Lom, thank you so much for the knowledge.
You're welcome.
We certainly appreciate it. Could have used it 2 weeks ago.
Next time.
Okay. Well.